Colon cancer involves the uncontrolled multiplication of abnormal cells in the large intestine. While predicting colon cancer development is challenging, potential early signs may indicate problems. These subtle or obvious indicators come from factual, expert-reviewed information by certified medical professionals. Colon cancer is called the silent killer because it usually lacks symptoms until the tumor is large. Over 100,000 new colon cancer cases occur yearly in the U.S., making it the third most common cancer in men and women, causing nearly 50,000 annual deaths. In this video, we'll explore the early signs and symptoms that may serve as vital indicators of potential colon cancer issues. Stay tuned as we discuss the subtle and not-so-obvious warnings derived from certified medical insights. Let's begin with diarrhea. Frequent, loose bowel movements are a common symptom of colon cancer. However, other conditions like irritable bowel syndrome, lactose intolerance, or inflammatory bowel diseases such as Crohn's or ulcerative colitis can also cause similar symptoms of diarrhea. According to the National Cancer Institute, some people may experience diarrhea from bacterial or parasitic colon infections. Detecting this blood can signal the possible onset of colon cancer in its early stages. However, bleeding from other parts of the digestive system, such as stomach ulcers, can also result in blood in the stool, so the presence of blood is not an absolute indicator of colon cancer. Certain medications like antibiotics, anti-diarrhea, or iron supplements may contribute too. Let's talk more about blood in the stool. Blood in the stool often comes from inflammation or a wound in the tissue inside the large intestine. Noticing this can be alarming, but don't panic. While it can be an early sign of colorectal cancer, it may also be caused by less serious conditions like hemorrhoids or an anal fissure. It's essential to get it checked by a healthcare professional to determine the cause and ensure your peace of mind. Colon cancer is very manageable when caught early. Early detection enhances the success of treatment, providing more options and potentially less invasive procedures. Furthermore, early detection significantly improves survival rates, as treatment can be more effective when the cancer is in its early stages. Unfortunately, 1 in 20 Americans will get colon cancer, so finding it early boosts positive outcomes. Moving forward, let's discuss more early signs of cancer. Other signs of early stages include changes to bowel habits. Colon cancer typically begins around age 60 but can affect younger people too. Changes in bowel habits are often the earliest red flags to watch for. A healthy colon facilitates regular, soft brown bowel movements. Any changes in frequency, consistency, and blood presence warrant attention. Constipation. It's well known the colon eliminates waste and absorbs essential water, nutrients from food. Sometimes, the colon gets blocked, disrupting its normal function. The result is constipation, an uncomfortable, awkward condition. Initially, constipation may not seem concerning, but it can actually signal early colon cancer. A study found over 80% of colon cancer patients had constipation before diagnosis. Various factors cause constipation, like medication side effects and low activity. Distinguishing normal versus severe constipation, like with colon cancer, can be tricky. If constipation lasts over 3 days, consult your doctor, especially with other symptoms like bloody stool and abdominal pain. Let's understand constant fatigue. Feeling constantly tired is a symptom associated with gradually developing colon cancer and usually lacks clear warnings. Although fatigue is a typical outcome of sleep deprivation, ongoing and unexplained exhaustion that doesn't improve with rest may suggest an underlying problem. Let's explore the link between fatigue and potential digestive issues. The colon eliminates waste, but blockages can lead to toxin buildup, fostering cancerous growths. If fatigue or pain persist, it could be an early sign of colon cancer. Other warning signs consist of feeling bloated or full. Feeling consistently full without consuming a substantial amount of food may indicate a digestive issue. Pay attention to the duration of these symptoms and other subtle hints such as changes in vital signs like weight loss, fatigue, or blood in your stool. Rectal bleeding. Rectal bleeding, although not always indicative of colon cancer, can sometimes serve as a potential warning sign. While common causes like hemorrhoids, anal fissures, or colon polyps may lead to rectal bleeding, it's essential to be vigilant as persistent or unexplained bleeding could signal an underlying condition, including the possibility of colon cancer. Regular medical checkups and consultation with a healthcare professional are crucial for timely intervention. Rapid weight loss. Sudden weight loss can indicate early colon cancer. However, symptoms depend on the tumor location and stage. Rapid weight loss doesn't exclusively occur with colon cancer but is associated with other gastrointestinal diseases. Weight loss can also happen for reasons unrelated to cancer. Older adults recovering from illness often shed pounds naturally. For example, losing over 10 to 15 pounds over months could signify potential issues like colon cancer. Heredity. Turning our attention to hereditary cancer, if a close family member such as a parent or sibling faced colorectal cancer before the age of 55, your risk is heightened. If two relatives are affected, that risk increases even further. Notably, among different racial groups in the U.S., African Americans face a significant risk when it comes to colon cancer. That's why understanding your family history is crucial. Early screening is crucial for colorectal health. If you notice any symptoms we've discussed, reach out to your doctor promptly. They might indicate colon cancer, though not definitively. If you have risk factors, consider discussing a health screening. Thank you for watching. If you found this informative, like and subscribe for more content. Leave any questions for future topics in the comments. Your support is hugely appreciated and helps us continue providing valuable health content.